everyone, today we are going to present a case study of the procedure of taking pulse and its various sites. Abid is 19-year-old male and he is being attended by the nurse Anina. She visited Abid in his room and the first thing she will do is the nursing process of the assessment and then the procedure and finally the evaluation. Purpose of taking pulse: to establish baseline date, to check abnormalities in rate, rhythm and volume, to monitor any changes in health status of the patient, to assess response of heart to cardiac medications, activity, blood volume and gas exchange, to check the peripheral circulation, to determine number of heartbeat per minute.
Pulse. Pulse is an alternative expanse and recoil of an artery as the wave of blood is forced during the concentration of the left ventricle. The pulse can be felt by the fingers on a point where an artery crosses a bone close to the surface of the skin. Common sites for taking pulse: temporal, carotid, apical, branchial, radial, femoral, posterior tibial. Pulse taken at various arteries. Temporal pulse. Temporal artery over the temporal bone. The temporal pulse is palpated on the temple directly in front of the ear with the index finger. Carotid pulse. The carotid pulse is a pressure signal acquired over the carotid artery as it passes near the surface of the body at the neck. It delivers a pulse signal signifying the variation in arterial blood pressure and volume with each heartbeat. Apical pulse. The apical pulse is a pulse site on the left side of the chest over the pointed end or apex of the heart. The apical pulse is palpated to count the pulse rate in infants. Branchial pulse. The branchial pulse can be located by feeling the bicep tendon in the area of antecubital fossa. Move the pads of your three fingers medial from the tendon and about 2 to 3 cm above the antecubital fossa to locate the pulse. Radial and ulnar artery. The radial and ulnar arteries supply blood flow to the forearm and eventually to the hand. The radial artery runs along the lateral aspect of the forearm between the bronchioradialis. At the wrist, it splits into superficial and deep palmar branches. Popliteal artery. The popliteal artery is a deeply placed continuation of the femoral artery, opening in the distal portion of the adductor magnus muscle. It courses through the popliteal fossa and ends at the lower border of the popliteal muscle. Posterior tibial artery. The posterior tibial artery is a branch of popliteal artery that supplies the posterior compartment of the leg and the sole of the foot. It coursing from the inferior margin of the popliteal muscle up to the medial malleus.